today I am Aisa Hamza, your nursing student from University of Mindanao. So for today's video, I will be demonstrating the Leopold maneuvers. Leopold maneuver is a central palpation of the abdomen for assessing the fetal position, presentation, and degree of descent. Purpose of it is to identify the number of fetus. Second is to identify the presentation, position, degree of descent, and attitude of fetus. Third is to identify the point of maximum intensity of fetal heart rate in relation to the women abdomen. All needed is pillow, tape measure, and stethoscope. Check the client chart and read the doctor's order for the said procedure, client condition and restriction, and the rationale for this is to ensure that you are administering the procedure to the right client. Do client assessment. Obtains of obstetrical history including the parity, gravitas score, LMP and EDC and AOG, and Puntic height. Take the vital sign. The rationale for that is to gather the data would make computation accurate and the baseline data prior to doing the procedure for comparison purposes. Hi ma'am, good day po. So ma'am, may mga tanong lang po ako about sa pagbubuntis niyo po. So ma'am, pag ilang anak niyo na po to?
First baby.
Okay po. Wala pong gravido, no? First baby pa man po. Kailan po yung first last menstruation niyo na first day?
November 20.
November 20.
2020.
Okay po. Okay, thank you po ma'am. So, explain the procedure to the client to elicit the cooperation of the client and reduces the apprehension and encourage the cooperation. Good day, ma'am. I am Isa, your student first for today. So, ma'am, I will be conducting a procedure which is Leopold maneuver, where I will palpate the abdomen for assessing the fetal position, presentation, and degree of descent. It is okay, ma'am?
Yes.
Instruct the client to empty her bladder before performing the procedure to avoid discomfort to the client and provide relaxation during the procedure. Hi ma'am, baka gusto niyo pong pumunta sa CR para umihi? Okay po. Gather the needed equipment and check for its completeness to be organized and promote efficient time management. Hand washing prior to the procedure and to deter the spread of the pathogen. The client privacy to ensure cooperation of the client during the procedure. Place the women in the circumvent position or supine with knee flex to relax abdomen muscle. Treat the client using the top sheet or blanket, exposing only the abdomen and place a pillow under her head. The rationale for this is to have an easy access during the maneuver to make client more comfortable and gain cooperation. Make sure that the hands are warm before coming in contact with the client abdomen. Rub the hand together and to prevent uterine contraction, and use the palm and hand instead of finger to prevent startling the client and to produce warmth. Over using both hands and facing the client, feel for the fetal part lying in the fundus and determine the shape, size, mobility, and consistent of what is being palpated. The finding is head and bridge. The second maneuver is one hand used side to steady and one hand side of the abdomen, while the other hand more slightly in circulation motion from top to the lower segment. Use gently but deep pressure and repeat this step on the opposite side using the opposite hand. Finding is fetal back and knee and elbows. Third maneuver is using a thumb and finger cross the lower portion of the abdomen above the symphysis pubis and press in slightly and make gentle movement from side to side. Finding for this is if it is not yet engaged, if it is still movable. Is still movable. Fourth maneuver is facing the foot part of the client. Palpate fetal head pressing downward about 2 inches above the lingual ligament. Use both hands. Finding is good attitude. If row correspond to the second maneuver that contain the elbow and knees. Poor attitude if examining the finger will meet on the obstruction on the same side as a fetal back. Place the client into proper position and comfortable to make client relax after procedure. Do hand washing to reduce transmission of microorganisms. So document the procedure and assessment. During the care, a careful record is important for documentation after client care and reporting the recording of information about the procedure must be accurate.